So talking about the cataract, basically, cataract is a very common disease. Is just for everyone. If we survive enough, at some point, every single human being, we all will get it. That's a natural, normal anatomy of the eye if you see it in the healthy eye part. And here, it's a bioconvex lens which provide a converging power to the incoming lights to focus it on the retina. That's how we see. So if this lens, which is basically a bag of protein over time, start to get a little bit cloudy and hazy, so obviously light cannot come into your eyes very efficiently. Next, please. So you can see here the image in the right side, which is the healthy eye, which is clear and nice. In the left image, you will see it's blurred and it's a little bit yellow, orange tint. It's because of the color of the cataract. So basically, cataract has a lot of symptoms, including cloudy vision, blur, glare, halo. People, they just explain it in a very different way. So if you feel your vision is not great anymore, maybe that's the time to check it out. Next one, please. So it's a common disease. It's not called disease anymore in many of the textbooks. It's a condition that everyone will get it. So let's say here in the US, we have many millions of the people with cataract. And talking about a surgical cataract, 3 to 4 million people that will get cataract surgery here in the US on an annual basis. Next one. Yeah. So what is cataract surgery? As I said, it's the most common and most successful surgery in the human body with millions done. And one more thing about cataract surgery is just it's exceptionally successful. So let's say every surgery you want to think of risk and benefit. So for cataract is mostly we are towards the benefit. So risk of surgery is extremely low. Risk of unexpected thing happen during the surgery is very, very uncommon. And most of those, anything happen uneventful, just like we can fix those down the road. And if you please go to the next slide. Right. So the question is, when you talk about cataract surgery, definitely is we are talking about the modern new approach of cataract surgery. Old-fashioned cataract surgery, the lens that we've been talking about is about 10 or more than 10 millimeter. It was a big incision, take the whole cataract out, but right now we have a very small incision. So we just work through an incision about 1 millimeter or two. That's why people, they don't need the stitches. And the cloudy part of the lens is basically fragmented and cut into small pieces and aspirate out of the eye. So then we have the empty space that we need dioptric power. So we're going to replace and inject a clear new lens inside of the eye, which is an essential part of the eye, is not an option. It's not about, okay, you don't put a lens in, you will have glasses after surgery. No. So cataract surgery always need a lens implantation in the eye. So we almost always will do one at a time. Usually is one eye is done in the bed, maybe just like a week or two based on the schedule and patient desire. We'll do the second eye then. Please, next one. Yeah, here is just good comparison about the different kind of lens. If you look at the first one, there are different kind of lens. If you heard about the standard, basic, or monofocal lens, so when we have only one focal point, basic of optics is saying we can only focus people for far or near. If we have two focal points, we can do it for both. If we have multiple focal points, we can do it for different distances. So let's say if you look at the image on the left side, the image is blurred. This one is blurred. The bigger baby on the bed is blurred. The smaller picture on the cell phone is blurred. So let's call the bigger, like a baby, as a far and the picture on the cell phone as a near image. So look at that. This first one has both blurry. After surgery, if we just the middle picture I'm talking about, if you have a standard lens, you will see far very clear, but still up close is not clear. Then you want to see something on your cell phone, you want to read or write something, and the working distance, you need a reading glasses for it. But talking about those multifocal lens or just lifestyle or upgrade, what people they call it in different ways. Look at that. This is the right image, and you will see the far and near, they're both in focus. That's how those lenses will give you far and near vision at the same time because they have one multiple focal point and they can get focus in different distances. You go to the next one for me, please. So let's say cataract surgery. Mostly, so here's the cataract. If you look at the old-fashioned cataract surgery was totally different from what we now have as a cataract. Just was a big incision, no lens at the beginning, some lenses afterwards, many stitches, many complications, long recovery. But talking about the modern cataract surgery, it's a fast, quick procedure. So it's done, takes about 10 minutes or less. You go home same day. It's just local anesthesia. There's anesthesiologist always next to us. We have a little bit mild IV sedation. You have an experience just like sitting on your couch and you have a little light nap after lunch. And just after a few minutes, you're out and everything is done. It's pretty much painless and not much of discomfort on it. But talking about the modern cataract surgery, let's say next level cataract surgery. If you heard about refractive cataract surgery, the goal is not just to take the cataract out. So during refractive cataract surgery or advanced cataract surgery, we're going to just take care of the cataract. And at the same time, we're going to help people to have the best quality of the eyesight. And we'll help them just to be free from glasses from far or near. And that's such a great thing. And it's a very huge progress in cataract surgery. And of course, you can imagine it's a very high technology involved procedure. You go to next for me, please. Yeah. So bottom line is that the surgery part is our part, and you had just like an overview of what will happen and what is the patient experience from the like a patient standpoint. But one more important thing that we always think of. So okay, so we want to have cataract surgery. Part of cataract surgery is implanting a lens in the eyeball. Okay, so that's a once in a lifetime opportunity. And honestly, it's almost very hard to give the idea how we exactly feel about those different lenses. That's something that you hear, but actually you experience it after the surgery. That's why we stress on education on different kind of IOL, intraocular lens style, to see which one is the best match for people. So overall, let's say there are different kind of lenses as we talked about. So some lenses, they only have one focal point. So we know people, they always would need glasses for up close and they will not correct your astigmatism. And so it's glasses is something that we expect after those lenses because they're not going to correct everything that we want. However, there are some lenses that look at those, they have different focal points. So you will hear from extended range of vision IOL, extended depth of focus IOL, trifocal. So they have three focal point. They can give you focus for far, for intermediate, for near. Multiple focal point, they will give you continuous range of clear vision from far away all the way to up close. Means up close is like a reading distance, like an arm's length. If you look at the right side of the image, you will see crystal lens, which is an accommodating IOL, which was there until a few years back, and we are not doing those anymore. I'm seeing in clinic many people, they had crystal lens from past few years back, and then for the second eye, we have to switch to some different kind of lens. That lens was a good lens for that day back then, but nowadays we have much better options. That's one reason it's not available at this point anymore. So it's not on the market. If you heard about the toric lens has all of the characteristic of a basic lens and has astigmatic correction on top of it. So let's say this is the lens that basically, if you use toric lens, that's the lens of choice for people with very high astigmatism. Then your vision for far would be free from glasses, but still you need glasses to read or write up close. On the other side, all of the lenses in the left side of a slide, they all correct your astigmatism, they all correct your far and near at the same time. The red one, that's basically the latest technology that we are excited about. If you heard about light adjustable lenses, those are just a great technology that for the first time in the entire ophthalmology, it just let us have a customized lens for any eyeball. Let's say pretty much all of the lenses, as you can see here, those are great lenses, but they're like a pre-made piece of plastic, basically. Meticulously, there are some measurement right at the table during the cataract surgery, and we can pick whatever we need to do. But the light adjustable means we do all of those, lenses inside of the eye, and from outside, we can adjust it. Let me show it to you. What does it mean? If you please go to the next one. Right. So it's a very unique technology. So far we never had such an opportunity just to do that. So basically, just when the lens is inside of the eye with no other procedure, just some light will come and change the shape of the lens to your best match. So let's say those light adjustable, first you can test drive your vision. That's the only technology you can go out, do your stuff. Here is reading or writing. Here is my driving. Here's the distance between my dashboard and my eyes. Here is I play piano. Here is my note. I play golf. Here is my like a working distance. So you can just go and do all of those like a daily activity and come back 3 times, sometimes 4, just to do adjustment to do the fine tuning. So basically, this is a jacket that someone just tailored it to you, not a jacket you can take off the rack. And so that's why it's just like a best fit, best match. In that sense, so far, these lenses will give you a highest quality of the eyesight. And these lenses also will give you highest chance of being totally independent from the glasses. If you go to the next, please. Right. I just want to give you some idea about what does it mean adjustment. LAL stands for light adjustable lens. And this is basically about the shape of the lens outside of the eye, inside of the eye. That clear part is in your pupil. So basically, just you're gonna sit in front of a machine. There are some measurement in place. Some lights comes and go, and some beeps, beeps, beeps. Just takes about a minute most of the time, or a minute or two, and the adjustment is done. And that's as easy as it is. But just like a downside is like a couple of times you have to come to the office and spend a little bit more time with us, which is a lot of work from like an office standpoint, but from a patient standpoint, it's just like a couple more like a visit. That we have people are coming even from long distances to get those lenses. And if you go to the next one for me. Right. There is one more thing on top of those couple more additional adjustment in the office. When you do those light adjustable lens, those are a little bit sensitive to the light. When the adjustment process is over, we're gonna do a locked in, which we got to the sweet spot. They're saying, okay, love it, lock it. When we got to the point that you really love the eyesight and everything is in the right shape, we're gonna lock it, and this would be a permanent lens at this point. So until then, which maybe takes about a few weeks, would be a month, month and a half or so, there are some eyeglasses. Those are basically just like a regular glasses, but they have a very good filter for UV filtration. So they come in the package of the lens. We will give those to you, and it's strongly recommended to use those lenses, the glasses on top of those lenses. Let's say you had those light adjustable. When you go out, for like a long day outside or just like a walking or whatever you do, that would be the best just to have the sunglasses. And for indoor, when it's very like a light or just like a strong sunlight there, you can use the clear one. So definitely that will help just to keep those potential for adjustment process, not like a randomly happen with the UV of the sunlight, obviously, right? So these light adjustable lamps, so far, those are one of the best treatment, especially for cornea that are unique. Let's say if someone has a cornea which previously had LASIK, RK, some kind of procedure in the past. So definitely every cornea would be very unique like your fingerprint. So how we can match a pre-made lens or piece of plastic to everyone, even if their power is the same. Let's say if my glasses is -1, your glasses is -1, the glass shop will give us the same lens from the shelf, -1 to both of us. But our cornea is not exactly the same, right? So we cannot make a custom-made glasses at this point, but hopefully someday we can. So that was the first step towards making a custom-made optic interface. That's why it's a very hot topic. And it's growing really fast in the entire United States and some part of the world, but we've been blessed to get those technology early on since the base and factory is in California close to us. So we adopted this technology a while ago and we are very excited and happy with that. And patients, they love it too. So if you please go to next. Yep. We talk about that. Okay, so that's look after the locking procedure. You want to use sunglasses, which is recommended for everyone. You don't want to use it or any sunglasses that your choice until the process of the locking is completed, which takes about a month or two. That would be a great idea just to have these special sunglasses. And if you please go to the next slide. Right. You know, just cataract surgery, more coming and coming on the table and the menus of a lot of options. So I just try to very briefly give you some idea about the different options that you might have at the time of cataract surgery. So sometimes we will see those options are all for you. And some options, sometimes you need to talk to your doctor to get the best option out of it. So what does it mean? So are you one of those people who really like work up close a lot, read the small prints a lot? Maybe some of those multifocal lenses, they just work better for you. You need strong near eyesight. Or are you one of those people who drive at night a lot? Some of those lenses, they're very high technology that will give you great vision. But for the first maybe a few weeks to a month, some of those lenses might give you a little bit halo at upcoming light when you drive at night. So that's a discussion that basically just want to just have a different kind of lens to make sure you just meet your requirement at job, work, life, where you enjoy your vision better. So talking about the next step in the modern cataract surgery, if you heard about those, is laser-assisted cataract surgery. So, and more precisely, we can say femtosecond laser and in the cataract surgery, basically. So many times when we do cataract surgery, we are about to sign up and talk about it. Very commonly, I'm hearing from patient, is it laser or is it something else? We have dozens of laser in ophthalmology. We enjoying it. It's a very unique technology. And the eye, because it's a clear media, you can just shine a light and that goes with no effect in the very clear media of the eye. And you can have some effect in some target tissue. So it's a very precise focus laser beam. And this is one of those two, femtosecond laser. So let's say, what is femtosecond laser? Next one, please. So yes, that's obviously, it's a laser and it's in the infrared wavelength. And it's a very short pulse of the laser. So femto, we all know, is just like a power of -15 of 10, right? So it's a very, very small number. Just to give you an idea of how short is the duration of effect of this laser. So look at the light, light, light planet right around the globe. And in um, across a human imagine femtosecond, very, very short period of time. So the femtosecond laser is a laser that just come into effect only for almost 5, 6, or sometimes 800 femtosecond. So it's a very, very short period of time. So if you go to the next one, thank you. So what is the benefit of laser? So let's say for years, we all are doing cataract surgery, which is a breakthrough. I'm telling you, it's just like I never had, fortunately, maybe chance or just like to get those old-fashioned cataract surgery that people they used to do 20, 30 years ago or so. But that the name for the new technology, cataract surgery, is phacoemulsification. It's a very effective, great way to do the cataract. It's one of the breakthrough for sure. Right now is one of the best. And basically, the technology involved ultrasounds to cut through the cataract, break it down into small pieces, and suck it out from a very small, as I said, 1 or 2 millimeter incision. Okay. So, but one step ahead and one level up, we have laser in the hand of surgeon just to increase safety and efficiency of the cataract surgery. So let's say if I want to do an incision, I can easily do it, right? But laser focus is very, very precise. So it's hard to beat it. Sometimes in practically we can say, okay, could be about the same. For some people, it could be true. But let's say everything we do, every incision we do with laser is more precise. That's just because it is, it's just like a different technology. It's just like, it's very hard to, laser beam is just like in a micron level. And when it's focused, it's just like a technically close to micron, size focus. So it's almost impossible to beat it at this point with the manual method. So when we're talking about the laser cataract surgery, you can expect, okay, precision is much higher, it's much more reproducible, and everything is just more precise. And obviously, there is less damage in the eyeball. What does it mean, damage in the eyeball? Cataract surgery is not something that causes damage in the eye. But the point is, every time we do cataract surgery, there's some energy there. There's some way to, basically block transmission of energy around the area that you work. But basically, it's an energy just to cut down those pieces of cataract to small, fragments and then suck those out and emulsify those and evaporate those. So it's a lot of energy. The point is, with surgical technique, we can just limit that energy usage. That's one part. That's your surgeon. But at the end of the day, ultrasound by nature, it's sound, and sound is a wave. And even if you just like a limited spread of ultrasound around, there is some ultrasound that goes around. And like any other wave, it has some energy. And you can imagine we are talking about 1, 2, 3 millimeter space when we work in this inside of the eye. We are not talking about a feet to two. Just like it's a very, very small, very, very small area. So when we work with ultrasound, nature of the ultrasound is wave and moving around. So always will give you some collateral effect. Okay. So which is basically eliminating by using laser because it's just very focused in a very, very small area. And if it's any collateral, we are talking about few micron. If it's a collateral with ultrasound, best surgery, best surgeon, best instrumentation is about few millimeter, which is for eyes a big, big distance. If you go to the next one, please. I just want to show you what does it mean. Okay, so here is the like a picture of an eye. We did a cataract surgery just recently. I just took like a screenshot out of it. So let's say if you see those green, like a crescent shape, those are like some incision we do on a cornea for different reason. Look at that. Let's say I want to just do incision from that specific point to that specific point. Yes, you can just put some ink on the cornea and cut it with a very precise best diamond knife. But laser will give you more accuracy, to be honest with you. If you want to translate, there are some studies in the literature. You will see in either side. Some they're saying, okay, so they do better, right? That's correct. So by technology, that makes sense. Laser is more precise than hands of every human being or any diamond knife or blade. But at the end of the day, if it's 3 or 3.1 or 3.05, does it clinically different? Do you see people better with the other one or so? To answer this question, I would say sometimes people they just want a safe and best technology for their eyes. Then it's there. And sometimes eye condition is a little bit different. Let's say if you have astigmatism, precision of the femtosecond laser assisted cataract surgery is much higher than the manual. So you can think of much better eyesight with those incisions and with the surgery with the femtosecond assisted laser. Let's say if someone has some special cornea disease, definitely this method will release much less energy inside of the eyeball, will cause less inflammation and cell damage in the eye. Let's say if someone had a corneal transplantation before, LASIK before, Fuchs corneal dystrophy before, those are diseases that affect other part of the eye. Let's say if there is any comorbidity in the eyeball, always laser will give you safer option because when you cut the cataract with the laser, your collateral, like a spread of energy, will come down to close to zero, or 1 to 2 micron, comparing to few millimeter for ultrasound. That's the nature and physics of those two ways. And the next one, please. Yeah, let's say those are two things that we are basically, if you think about, okay, I want to do a refractive cataract surgery, I want to do a modern cataract surgery, what is the best way? So if you want to do your cataract, you do it with laser, do one of those lenses that are just in a higher, like a optical function, that's how it is. So those are the combination that gives you highest quality of the eyesight. Any astigmatism is corrected at the nodal point of the eye, which give you less distortion, let's say. I just want to give you a very quick uh, information on something that we call it aura, which is optiwave refractive analysis. Aura is a technology. We have it in pretty much all of our OR. And those are actually very helpful too. It's not like a brand new like light adjustable or so. We had it for years. But what does it mean aura if you heard about that in cataract surgery? Let's say, so it's a lot of measurement preoperatively the surgeon and the assistant, the optometrist will do to select the power of the lens for you and do the surgical planning, right? It's a lot of number. You will see almost like a 10 pages of different full of numbers. So we will say, okay, here's the best power of the lens. Here's the axis of astigmatism. Here's the surgical planning, basically, right? So, and they just work mostly great. But the point is, what is the basic of those calculation and mathematics? Those are regression formula based on general population, right? So let's say general population biology things, they're just like a bell curve. So most of the time people are in the middle and they just work really great for them. For some people, it doesn't work great. Those are in a little bit towards the end of the bell curve. Let's say some eyes are really bigger than average. Some eyes are a little smaller than average. Some eyes had a history of procedure like laser or LASIK in the past. That makes it a little bit more unpredictable comparing to the untouched eye that you can use those regression formulae on those very easily. So aura is an instrument which is connected to the microscope, and this is this part, and it's a couple of wires that connected to a base. And so basically, at the time of cataract surgery, after the cataract surgery removed, so we have a clear media, everything is very clear. Now, aura measurement will do a real-time measurement, which is like almost more than 100 measurement, again, laser beam focus. That will give us some more accuracy to the measurement that we did before the surgery, right? So those are also very important and very helpful. Sometimes we have all of the measurement, all of the math was done, which is basically based on those regression formula, which is population-based database. But that one is, again, individual metric measurement for that specific eye during the surgery. And so it's very helpful. So aura also is a part of the measurement and planning for anyone with refractive or modern cataract surgery. And next one, please. I'll definitely leave a time for a question and answer in a moment. I just didn't want to talk about this one that much. And you will see, let's say if someone has glaucoma, which is I understand is not for everyone, there are some glaucoma surgery, which those are usually a very invasive surgery. Sometimes it's a little bit hard. And for the patient, for the follow-up, in terms of many different things. But at the time of cataract surgery, this is a extra benefit for people with glaucoma. We can go inside of the eye and work on the angle of the eye, which is the area which is responsible for eye pressure to help with that. If you heard about mixed or micro-invasive glaucoma surgery, those are basically in contrast to those conventional glaucoma surgery that is very invasive, actually. So iStent is one of the brand, one of the oldest one. That's why I have it here. There are several other options, and they are just expanding those more and more. Some are just good for mild, some are good for moderate, and nowadays some of those they just work really good for severe glaucoma. So this is something that at the time of cataract surgery maybe just takes another couple of minutes with not much of risk. We can do that. Will you please go to the next one? Okay, so we're gonna just do our question and answer in a moment, but let me just give you a few things that I just found in the last few webinars. Those are just like a very hot topics, and they're just like a really um, point of question for many people. If you go to the next one. Yeah, next one, please. Thank you. So, how safe is cataract? What is the complication? We talk about that. Sometimes I never forget, okay, so it's my daily job. I'm doing how many of those, and it's just like a routine for us. As a patient view, it's the first time someone is one touching your eyes. It's so important. We are very sensitive to make sure every single patient feels safe, comfortable, question answered, then proceed with that. That's a happy surgery almost always, like 99.9% of the time. And I personally like to see my patient enjoying it. It's a little journey, right? But it's a quick, easy one, and mostly it's very rewarding. So if you want to say 100% safety, we don't have it in real life. You take a flight, you drive your car. But let's say the risk is way, way lower than what we do on the daily basis, right? So basically, it's a very safe procedure. When we say less than 1 in 1,000 possibly risk for problems, it makes you like a 99.9 success rate, which is wonderful. There's some cataract which may carries a little bit more higher risk. Maybe someone had a history of trauma to the eye, some previous surgeries, someone had a bad laceration in the eye. I'm not talking about those at this point. That's true. There are some special cataract that they just might have a little bit higher risk, but talking about average cataract that people they can get, it's just very, very low. And next one, please. So it's barely you will see people they feel pain in the eye. Sometimes they just feel a little pressure, but not much of pain. So you basically just have a little bit topical drops and IV sedation for most of the people, but if that's true. Some people they feel a little bit anxious about even dental work. I'm possibly one of those, I guess. Then then a little bit of sedation before the surgery, and you were looking for something around 10 minutes. And as I said, almost always you go home same day. I never saw anyone, if systemically you do fine, there's no reason we keep you in house for the eyes. And next one, please. Yeah, just you always need to have someone to drive you back home. You can drive yourself, but not recommended. And looks like it's a policy not to, because even if you got or not, it's hard to say how much sedation you will get. Are you just alert and not sleepy enough to sit behind the wheel? That's the point. Otherwise, you'll have the rest of the day pretty much as a normal day. But that would be necessary just to have, like any other procedure here in the country and any OR. You should have someone to drive you back home. So we will give you some protective shield and sunglasses. There are some eye drop you have to use for the next maybe a few weeks. So pretty much you don't want to do a very strenuous activity and exercise for the first week or two. Let's say dental work, you should have postpone it for about a week or two. Any chiropractic or those sort of things, definitely we don't want it for a couple of weeks. Next one, please. And so, yeah, it just scheduling for a evaluation for cataract surgery. Maybe the most important thing I want to mention that dilation of the pupil is almost always necessary. We want to do some testing. We want to do some baseline measurement. We need to look at the back of the eye. So if anyone is coming to cataract surgery evaluation, should be expecting some dilation of pupil if you want to plan ahead of time. Some people, they just feel comfortable hitting the road, drive back home, and some people, they feel more comfortable having someone next to them. And next one, please. Yeah. So, thank you so much for your attention, and we are open to any question at this point or any comment at this point.